So what is blood pressure? Let's start there. Blood pressure is how hard your blood pushes on your arteries when it's going through your circulatory system. It's the simplest way I can explain it. The reason we take blood pressure is to check your risk for heart disease, stroke, heart attack, hypotension, and hypertension. It's really important so we can prevent things like stroke, heart attack, and let you know if you're at risk for heart disease so you can take special precautions to make sure you don't get a heart disease. The normal blood pressure is 120/80, and that's average, and people a little bit older it's a little bit lower, and that's okay. I'm credible because I'm a CNA. I take daily vitals on 14 of my hospice patients. And sometimes our machine is down, and when it's down, I have to take it manually. So today, I'm going to show you guys how to take a manual. Okay, so here's my little helper, Claire. I'm going to take her blood pressure. So the first step is finding the right size cuff, because if the cuff isn't the right size, you're not going to hear the heartbeat, or it's going to pop off when you start tightening it. So on the inside of all of the cuffs, they have this, and it's a range for how big the arm can be. The easiest way to measure it is it's as big as your bladder, so you just hold it up like right there. That's as big as her bladder this cuff will fit. And so the next step is you're going to want to find her brachial artery. Because she's so little, it's kind of hard to find, but what I do is I feel for it. Right here, it's not like squishy, but right here in the middle, it's spongy, and I know that's the brachial artery because it kind of bounces back when you push on it. So you're gonna wrap the cuff around like this, and there's an arrow on all of the cuffs, and it tells you that that goes right above the artery. So wrap the cuff just above the artery, like that. And now you're gonna want to put your stethoscope on. They face outward to the patient. That's how you know it's on the right way. And you're gonna place this right here over the artery. I like to tuck it in like that so I don't have to hold it. So you take the blood pressure meter and you tighten this so that way no air gets let out, and you pump it up until the meter says 180. So I'm going to start pumping. It's going to get tight, okay? Keep your arm relaxed. So it's at 180, and once you get to 180, you're going to start listening, and the first number that I hear her heartbeat at is her systolic number, her top number. So I'm going to let the air out slowly, and I'm going to listen for the top number. Okay, and now I'm going to keep letting the air out, and I'm going to listen until I don't hear her heartbeat anymore, and the last number that I heard her heartbeat at is her bottom number, her diastolic number. Alright, you're about 136/85, and that's healthy. That's a normal range for somebody her age.
My hand.
And now take the cuff off, and it's done.